Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Lurasidone. Its brand name is Latuda. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how Lurasidone works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe this medication. We'll then discuss examples of dosing, and then stick around till the end where we'll talk about side effects with percentages. So how does Lurasidone work? Well, first of all, it's an atypical antipsychotic agent. It is an antagonist at dopamine type 2 or D2 receptors, as well as 5-hydroxytryptamine or 5-HT2A receptors. It's also a partial agonist at 5-HT1A receptors. In terms of indications or reasons we would prescribe this medication to a patient, we often see it used in the depressed phase in bipolar disorder, either as a monotherapy or in combination with lithium or valproate. This medication can also be used to treat schizophrenia. With respect to contraindications or reasons we would not be able to prescribe Lurasidone to a patient, first one would be if a patient had a hypersensitivity to Lurasidone or any other component of the formulation. It's not to be used with strong CYP3A4 inducers. An example of this would be carbamazepine, and it also shouldn't be used with strong CYP3A4 inhibitors. So an example of this would be ketoconazole. Now what about dosing with Lurasidone? So in bipolar disorder, as an adjunct therapy, the initial dose would be 20 milligrams orally once daily with food. The maximum dose would be 120 milligrams once daily. In schizophrenia, the initial dose would be a little bit higher here at 40 milligrams orally once daily with food, and the maximum dose would be higher as well at 160 milligrams once daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Lurasidone, so I'll go over some of those here now. 2 to 7% of patients may experience weight gain, while dyslipidemia may occur in 4 to 14% of patients. 1 to 13% may experience increased glucose levels, and 3 to 5% may experience diarrhea. Nausea seems to happen 10 to 17% of the time, and vomiting 2 to 9% of the time. Akathisia may happen in 6 to 22% of patients, and Parkinsonism may happen up to 17% of the time. 7 to 29% of patients may experience somnolence, and 4 to 5% may experience anxiety. Now, some more rare but serious side effects would be orthostatic hypotension, which would be a sudden drop in blood pressure when going from a seated to a standing position, as well as suicidal thoughts. That's all we're going to talk about today with Lurasidone or Latuda. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.